Hello everyone. Welcome to Lifey Life. Conception for herpes in men. The reason for herpes on a male member is a clear contraindication to pregnancy planning. The acute form of the disease provokes infection of the second partner and the future baby. Only after intensive therapy and subsequent medical supervision is possible a variant of healthy conception and positive delivery. The development of infection on the genitals complicates the sexual intercourse and weakens the spermatozoa, making them less mobile. But still the probability to conceive remains. Especially dangerous primary infection during pregnancy. Therefore, a man must undergo systematic diagnosis and exclude unprotected sexual intercourse with the appearance of such a diagnosis. Influence on the reproductive system of men. Herpes on the genitals are classified as venereal diseases, accompanied by extremely unpleasant symptoms. It has a direct relationship to the reproductive function of men and often serves as a barrier to the birth of a healthy fetus. Main influence: decreased functionality of spermatozoa. Sperm quality decreases. Spermatozoa become lazy. Even if the infection does not produce itself, it should be remembered, the acute form of the disease is accompanied by abundant eruptions on the genitals, itching and pain, which makes it difficult not only to conceive with herpes in men, but also the sexual act itself. The virus contained in the sperm infects a woman and affects her ability to tolerate a healthy baby. But most of all the fetus suffers, as it will not be possible to avoid infection of the baby with infected parents. This virus greatly reduces immunity. Because of this, there may be a number of dangerous ailments that the body cannot suppress itself. Is it possible to conceive in an acute form? Pregnancy planning involves medical examination of both partners and the subsequent treatment of diseases that interfere with fertilization. During the acute form, genital herpes and conception still remain not mutually exclusive concepts. Physically perform sexual intercourse and impregnate a man can, but this is a direct effect on the fetus. Initially, you need to undergo a course of treatment and only then, after consulting with the treating doctor, plan to conceive. Herpes can cause the development of herpetic prostatitis. Here, the opinion of doctors about the possibility of conception diverge, in view of the lack of necessary research. But it is known for sure that the lack of treatment with such a disease leads to infertility. At the time of exacerbation, one should refrain from any sexual contacts. What is the danger? At the initial stages of herpes development, most men do not feel any discomfort and do not notice the manifestation of the disease. Unprotected sexual intercourse in this case leads to infection of the woman. The influence of herpes on the conception of acute stage is fraught with miscarriage, fading of the fetus, violation of the skeleton of the child, the appearance of infection in the infant, a decrease in immunity, which provokes the appearance of concomitant ailments, problems of development of vital functions. The acute stage affects the reproductive function of men, the health of women and the fetus. If a man has genital herpes already at the time of partner's pregnancy, then the sexual act is prohibited in both the vaginal and oral and anal forms. Otherwise, the risk of infecting a baby with an infection is very high. Pathogenic microorganisms quickly spread through the body through the mucous membrane, affecting all systems of human organs. Reinfection is less dangerous than the primary form of the disease at the time of pregnancy. According to statistics, primary infection with the herpes virus during pregnancy causes high mortality among infants infected with an infection from the mother. Every seventh kid is sick and at an early age every second of them dies. In 7% of cases, a recurrent virus appears. And every third pregnancy is accompanied by a miscarriage in the first trimester, and an even greater risk of terminating pregnancy appears in the third trimester. Planning pregnancy with sleeping virus. If at the time of diagnosis the level of antibodies in the patient's blood was high, it is better to postpone conception planning. In this case, a man often does not feel any unpleasant symptoms. After medical therapy and after the vaccination, which is done to a woman to protect herself from herpes, you can start planning pregnancy. When rashes more than 2 times a year, a man should begin intensive treatment. A woman should also undergo mandatory diagnostics. Do not ignore rashes on the lips or other skin areas, as they can become harbingers of the appearance of vesicles on the genitals, although they themselves are not the reason for giving up pregnancy. The minimal period of recovery after a course of herpes therapy is 6 months. With a chronic ailment, remission becomes a desirable period for conception. Thank you for watching. Make sure you like the video and subscribe for our new content. Click the bell sign to stay in contact with updates from us. Hope seeing you back on Lifey Life.